Welcome. We're excited to talk about how digital innovation can empower medicine. I'm Richie Hoffman. I'm a cloud healthcare architect and manager from Pariveda Solutions out of our Houston office.
And I'm Nicholas Desai. I'm the Chief Medical Officer and Chief Quality Officer at Houston Methodist Sugar Land and CMIO, prior CMIO.
All right, so first a quick introduction to Pariveda's partnerships. We're proud to be partnered with AWS. We have a strong partnership. We're a premier consulting partner, and we hold their healthcare competency designation along with many other competency designations. So we know AWS, we know innovation, and we know healthcare. We're also proud to be partnered with many healthcare providers across the country, and especially privileged to be partnered with Houston Methodist, who's leading medicine in so many areas.
Hey everyone, so forget the titles. Our job here is the same, right? We're here today to be the Chief Happiness Officers, right? That's what we're here to do, to transform care and how do we deliver it. And so we're an 8-hospital system here in Houston, Texas, right? So we have technically 7 hospitals. One is an acute care hospital, long-term acute care hospital. What's interesting about our hospital system is we're in the central Houston metro area. However, what's interesting is majority of our providers are private. We live in a fee-for-service market. We have about 1,000 physicians that are employed. We have an academic medical group, so we have a learning residency center as well. And each of our community hospitals are almost standalone centers of excellence, if you will. So it's kind of what's unique about how we deliver an experience to our customer, and our customer is defined by anybody, which is our patient, our provider, our nurse, our caregiver. So as you'll hear from our talk today, we're talking about journeys and the longitudinal care of a patient, and how do we weave transformational innovation using voice into all of that.
Yeah, so as we know, healthcare is a journey that begins at birth and goes all the way into end-of-life care. And there are opportunities to innovate all along the spectrum. And what's more, to attach digital connection to tie it all together. So for today, we're just going to focus on a very thin slice of an individual's healthcare journey, a medical incident, and rehabilitation. So for that, let's meet a typical patient, Lena, and see how well-placed technology transforms her experience. So for a bit of context, Lena was feeling numbness and tingling in her arm. She met with her primary care physician, followed up with a specialist, and found that she had spinal stenosis and would need a spinal fusion from a neurosurgeon. So already we're kind of seeing that journey of initial visit, consultation, anticipating and receiving care, and then her post-care follow-up with inpatient surgeries and then her outpatient follow-ups.
Awesome. So can you guys hear me well? All right, great. So the reality is there's so many digital touch points, right, in our care journey of a patient. So whether it's from the front end when you first walk in the door, or selecting the provider, to, hey, what is it about, how do I improve that experience, to kind of what I would call you, if you look at this journey, and I see the line that says anticipating care, but really at the end of the day, it's about show me, know me, and then care for me, right? If you really think of it in those terms, that when you know me as a digital touch point, you think about how do you have that unified way of knowing me? Could you easily import my information in? Can you make it easy for me to schedule? Are you able to track recommendations and things that I might need? So when I show up, you know me. The next part of that journey, no matter where you're at, okay, so now that you've kind of understood that, well, now teach me or care for me. And that is really around, how do I take that information, how do I create that experience when you're in my audience, in front of me, to not lose sight of that physical eye-to-eye contact? How do I still deliver on making sure your prescriptions are sent to the right place? How do I ensure that your connectivity between you and I understand what's needed next? And then most importantly, how do I close the group on making sure we've interacted with you so that you know exactly what your next steps are, right? That's part of it. it doesn't stop there. The next piece of it is really the kind of follow me, which is really the post-care. How do I close the loop? And really talking through how do I bundle my appointments together? How do I share a singular bill? Like all of these are digital touch points. But more importantly, in this journey of Lena, we're gonna talk about how each of those might mean for us to use a keyboard or something else to create that experience. Here we're gonna highlight how we've used voice to eliminate some of those barriers to where we restore that experience to be, hey, the physician, provider, patient, caregiver experience becomes more unified. And while doing that, we're also gonna share with you how we take what voice means and segment it into both a conversational component or ambient listening, and then more of we're also gonna share with you the next piece of it, which is really task-based. How do you converse and drive quality in a very different, unique, safe way, right? Across the board. So, first one I'm going to talk about is that experience in the office. So Lena has come in, you've seen her, but now, okay, so we're about to start this examination. In our typical journey fashion, I'll use myself as I see patients. My computer on wheels is behind me, my exam chair is in front of me, and I'm seeing the patient, and what do I traditionally do? Turn around like, yes, Lena, what can I do for you? And it really dehumanizes that experience. However, if you go back to a few years ago, when we all remember there was something called paper charts, and when people just kind of brought you back to the exam room or the consultation room and you just chatted, the experience was a bit different. I mean, I remember that growing up as a child, like you would see the doctor, then you'd go to the little side room, and then you'd actually have a conversation. Well, things have changed, but how can you restore some of that? And so in this scenario, we worked with Pariveda and AWS to use Amazon's Transcribe Medical and Comprehend Medical engines to kind of really take a facilitated conversation, pull those components out of that, of really the elements that we want to kind of capture, and then put that into a structured note. So why is that important? We can all learn to use macros. We can all learn to use canned notes. But sometimes we lose those inflections that might be very specific to driving something. For example, Lena might have told you she strained her back because she was lifting a heavy package, or something that might have incited that event. But if that wasn't captured, you might have forgotten it. Can't remember seeing so many patients and every little aspect of it. So partnering with Amazon and leveraging their two solutions together, we've been able to really create an opportunity to say, this note has now untethered the physician, he or she, from a keyboard, by leveraging voice to drive that conversational speak. And we've been able to take that information, put that directly into our EHR, reducing time behind the desk, improving an experience, being able to, in the moment, show you your summary of what we did and discussed today at the point of care. So to me, that has kind of changed, and it's the cusp of changing the way we approach delivering healthcare, right? In a very unique way, while leveraging conversational voice. So now patient setting, this is what we've done to kind of create the beginnings of what the future of voice really means. Now, taking that, and so we've got to really thank Pariveda and AWS for this, because they allowed us to dream. And with that, let us dream to the next level. So everyone dives into voices being, hey, you can do some of this today. But now what happens if I can untether myself from even any of it and leverage it in different areas of venues of care within the hospital itself? Now we're talking inpatient. Now close your eyes for a moment and think about running a code. Imagine if you're in a ER trauma bay. Or now I'll take you into the operating room, which is what I'm going to really cover today for you. But in the operating room, I'm gowned up, and I will tell you oftentimes who is expected to lead these events. It's the provider or the surgeon on deck. Oftentimes it's a confluence of, hey, the nurse runs some of it, the doctor runs some of it, but how do you bring safety into this? So playing my other role, which forget my Chief Happiness Officer title that I desire, but playing now my quality role, I've got to embed safety in all the technology that we're building. And so when you take that concept, so we wanted to leverage task-driven commands to drive actionable items, actionable insights, if you will, so that one, when I'm in the moment of care, I can deliver it in real time in a way that's easy and voice-driven. So leveraging Amazon Lex, we were used to use that interface, and then with kind of taking that utterance, making it into kind of into an influence, and then taking that, bringing that back up to being something visual that they could see, right? So you'll notice that we leverage these two solutions in the same way to kind of awake the system. We were able to drive using the word or the command to drive an instance, and then being able to present that information in a very unique way. So now imagine an 80-inch screen on the wall in the operating room where when I say initiate surgical safety checklist, and at our booth here we'll be able to show and demonstrate some of that, so to be able to initiate and command that, and it writes back to Epic, now you've taken away other touch point steps that previously were not, or had to be manually entered. And so clearly, what we'll be happy to show you is that in this scenario, it's not just about completing the checklist, but now imagine what we've been able to do now differently. So what you're seeing around the bend here is what the opportunities that exist with voice. So first and foremost, the surgical safety checklist we've been able to complete by using someone's voice. So now the provider, when I walk in the operating room, I can drive these commands. So computer, initiate pre-induction timeout. And all those checklists that we have to go through manually that we write back into our source EHR solutions, we're able to now capture with someone driving that ship. With now the nurse safety checking, double checking to ensure that it's written to the right location. Second of all, in the midst of that fluid dynamic environment, something happens, and I might need to know if there is a medication allergy or a reason why the patient might be bleeding much. So I could easily say, computer, show me medication list, and be able to open up the active meds so I can see if maybe perhaps the blood thinners were not turned off on time, to see if there's in real time looking at dynamics. So when you start going around the bend, think about it in a way that we've been able to initiate the tourniquet timer. If I had a perfusion timer, I can see in a real big visual way, an easy to formatable way, with just a visual cue of saying, here's a timer counting downward, but driven by me, to where I can also stop the timer if should it be needed. Flipping that around, now let's talk about something even deeper, which is probably what I, hospital on the administrator side, now putting my other hat on, care about, is how are we operationally using our flow and our throughput properly? So by being able to truly capture start time, close time, actual surgical time, which we can probably do in some of our data analytics within our EHR solutions, but having real-time capture allows me to now drive predictive analytics around operating room utilization, personnel management, and then now imagine, if you will, what I call compression time, which is the time you need between turnover time between the case closed and the next case. Now imagine if I could trigger my EVS team to be ready when I say incision close. And now I can do that. These are the things we've been able to pilot and try to start with and doing with what we've been able to create with AWS and Pariveda. So if that hopes to give you a little bit of a snippet of like the what can I do, or reinventing, if you will, now imagine this is where we've segmented the conversation into conversational voice and task-driven voice. So because they all sometimes get lumped as the same, and we've really been very meticulous in parsing this out. So when we're redesigning or redeveloping, we're working with our partners to really focus on those areas of care. So we can now think about a code that you can use your voice to capture it versus having a secondary scribe to capture it like we might do today. Or in an exam room where you might want a a second person, but I now have my hands tied, so how do I capture it in real time? So the opportunities are endless. The innovation solution deck is there for your taking. But these are some of the things we've done with AWS and Pariveda. So thank you, and I'm going to turn it over to Richie to kind of talk about the nuts and bolts, because much smarter guy than me to talk about that.
Yeah, thank you. All right. Yeah, so with Pariveda, we're able to distill these learnings of how voice works to create this reference architecture to enable your organization, and it makes full use of AWS's suite of AI-driven technologies. So Amazon Comprehend Medical, Transcribe Medical. And really, this process begins with our teams coming on site with discovery and process identification. We'll work with your teams, we'll identify where there may be unnecessary manual steps and where this technology can really add value to your workflows. As we begin development towards that reference architecture, we keep in mind your operational costs, security, performance, how does it scale, while also adding focus to change management, communication, planning, and training. And really, this is just a small slice of how innovation is transforming the way that we empower medicine. And this is happening across the industry on this entire spectrum of that healthcare journey. So if your organization's not already considering that holistic patient journey, it's time to begin. So modern advances, they're changing the way patients and providers are engaging with one another. And so once again, we're just happy to be partnered with Houston Methodist and AWS, who are at the forefront of all of it.